Good morning, everyone. We are going to convene this morning's Public Health Committee meeting. And it's great to see you all here on this wonderful day after the Super Bowl. And I just have to say congratulations to the Philadelphia Eagles. As a big Eagles fan, I know there aren't a lot of you out there, but had to be said. Yes, thank you, Clara DeStitro. We today have concepts to be raised on our agenda. We will be JFing our first bills out of committee today, and we have a couple bills to be reserved for subject matter public hearing. So we will get to those agenda items, but first, Senator Amar.
Thank you, Madam Co-Chair. Nothing to add. Thank you.
Great. Representative Clara DeStitria.
Thank you, Madam Co-Chair. Ditto.
Wonderful. I will add that, as you all know, there are many different meetings and hearings happening. I know Senator Summers is called in a few different places as well. And we know that that's true for our members. So I'll start just by saying we will be holding votes open until 3 p.m. today. So with that, we will move on to item number 3 on the agenda, which is concepts to be raised. And this includes items 1 through 14 and then 16 through 18. I'll read them. An act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. 2, an act concerning the Department of Public Health's recommendations regarding emergency department diversion. 3, an act concerning the Department of Public Health's recommendations regarding physician recruitment. 4, an act concerning the Department of Public Health's recommendations regarding drinking water. 5, an act concerning the Department of Public Health's recommendations regarding food safety and oral health. 6, an act permitting emergency medical technicians to administer glucagon. 7, an act concerning the recommendations of the working group to study non-alcoholic fatty liver disease. 8, an act concerning the recommendations of the working group to study staff safety issues affecting home health care and home health aid agencies. 9, an act permitting naturopathic physicians to prescribe certain medications. 10, an act concerning the recommendations of the Office of Child Advocate regarding oversight of children's autism spectrum disorder services and infant mortality review program. 11, an act concerning licensure portability for marriage and family therapists. 12, an act concerning the tobacco settlement funds. 13, an act concerning patient health information included in and opt-in and opt-out procedures related to the statewide health information exchange. 14, an act concerning well water quality. 16, an act concerning biennial studies of payment parity in the private insurance market and Husky Health Program. 17, an act concerning safety plans and discharge plans for minor patients. 18, an act concerning non-emergency transport of persons in a prone position via stretcher vans. May I have a motion?
Madam Chair,
Beverly?
did we do number 15?
No, we did not. So these are items 1 through 14 and 16 through 18. We will not be raising item number 15 today. Thank you for clarifying. So I had a motion from Senator Amor and a second from Rep. Clara DeStitria. Is there discussion on the concepts? Senator Amor.
Thank you, Madam Co-Chair. I just wanted to make a couple of comments on the bills. For item number 6, an act permitting emergency medical technicians to administer glucagon. This is actually about intranasal glucagon. So I just wanted to make sure, because they can already provide the glucagon that is not intranasal. And this concept came to us through Senator Harding. And then we just wanted to have a conversation. It makes sense to have something like this. And on another topic, item number 7, an act concerning the recommendation of the working group to study non-alcoholic fatty liver disease. If you remember, we had a group that was looking at this. So medically, we are not looking at NASH as a disease. We have changed the name to metabolic dysfunction associated steatotic liver disease, MASLD. But this is the same concept. So just wanted to make sure that we were in sync with the medical terminology. Thank you.
Wonderful. Thank you. Is there other discussion on the item before us? Seeing and hearing none, if you are online, if you could unmute and prepare to vote. All those in favor of raising these concepts, please signify by saying aye.
Aye.
Opposed? Thank you. We will move on to item number 4 on the agenda, bills for JF action. We have item number 1, Senate Bill 1191, an act establishing a pancreatic cancer screening and treatment referral program. This is a JF to the floor. May I have a motion?
Motion.
Moved by Representative Kit, seconded by Representative Cavros DeGraw. This item is one that we heard, as all these are, at our first hearing. This creates a screening program similar to some of the other screening programs that we have within the Department of Public Health. This is within available appropriations and is geared towards specifically the underserved community. Discussion, Representative Leslie Zupkis.
Thank you, Madam Chair. I think you just answered my question. What if someone has a high risk of pancreatic cancer and they are not considered poverty level, but their insurance does not pay for it? Would they be covered under that?
So I'm not certain of the answer to your question, actually, Representative Zupkis, and I will say this bill, I think we've had good discussion in our screening conversations about wanting to move forward. We believe also based on some testimony from the department that we will need to have some conversations to kind of clarify and probably determine how we can best move forward with the program.
Thank you. I'm for the bill, but I think that there could be people that are not considered poverty or hit that threshold and their insurance doesn't cover it. And I think it's important for everybody because as we know, pancreatic cancer doesn't pick who it attacks and who it doesn't. Thank you.
Thank you, Representative. Representative Cavros DeGraw.
Thank you so much. I just wanted to thank the chairs and rankings for bringing this forward in the first place and the fact that we're JFing this now. I share Representative Zupkis's concerns because my first experience with pancreatic cancer was the summer I turned 4 in 1980. My great aunt was diagnosed with pancreatic cancer, and at the time, she was one of 6 in the family, and they said that it was a 1 in a million shot that another sibling would get it, and so they really didn't have screening. They did, I remember at the time I believe one of Jimmy Carter's siblings had it, and they, again, oh, it's a 1 in a million chance. We know so little about it. And then when I was in college, my godfather, who was her brother, he ended up passing away from it. She got 4.5 months. He got 9 months because, as we've heard over and over again with pancreatic cancer, by the time they find it, it's too late. And then in addition to that, their father, years and years and years ago, before there was any kind of decent medical screening, they said it was liver cancer, but he was orange, and usually orange is the kind of jaundice that goes with pancreatic. So we've lost at least 3 family members and possibly a 4th. So I just thank you so much because this early screening is beyond critical. And we as a family have followed the research at Johns Hopkins, followed the research at MD Anderson, the many attempts at trying to have this early detection, because even with procedures like the Whipple, so many folks do not get a second chance when they have this diagnosis. So I do hope that we can expand this, but I am thrilled to vote yes today on this. And again, thank you so much for your leadership on this because it really matters to so many families.
Thank you, Representative Cavros DeGraw. And today, our condolences to all those who are survivors, and our special thanks to all who are here today and we're here for our hearing as advocates, not just for this bill, but for those who are suffering and struggling through pancreatic cancer. Seeing no other Senator Anwar.
Thank you so much, Madam Co-Chair. I just want many of my colleagues who are speaking around this circle, I think we're having some problems with the sound system. So you can see that now you can hear it better. I think we've fixed it. And the Representative Jenga has a question. I just wanted to mention that this bill is going to be one of the first steps to make sure that the insurance is going to cover this aspect as well. Because right now we are in the process of raising the awareness, which is not only for the public to be able to be aware that there is opportunity for screening. Unfortunately, we cannot require the insurance companies to do too much through this committee, but we are trying to set, if we pass this bill and move forward, that would be one more reason for having a serious conversation with insurance companies. The data is there, and the clinicians who deal with this, they are also going to be able to get some better understanding about opportunities and how they can fight for the people who are insured or underinsured to be able to get appropriate screening. So again, it's public education, it's ensuring medical follow-up, and it's also supporting the healthcare providers through this bill, along with the expanding of the access for the people who do not have any. So I just wanted to make a comment on that. Thank you.
Thank you, Senator Anwar. Representative Jenga.
Thank you. This is a great opportunity to have a significant impact on the #2 death in Connecticut. And while we're doing that, there's somebody that should be recognized for his persistence, and that's Dino Varelli, the CEO of Project Purple. He's been at this 15 years in honor of his father, and he's very excited to see this come to this state of his own. But I'm also excited to see it come to our state, and I think recognition of his work and persistence is also proper. Thank you.
Thank you, Rep. Jenga. Rep. Claridis Tetria.
Thank you, Madam Chair. And I'll end up reiterating what most of my colleagues said today. We know, unfortunately, that there's not one test that will identify if you have pancreatic cancer, but it's about going through the process and those little steps. The research has shown that people that have certain genetic mutations are more apt to develop pancreatic cancer at some point in their lifetime. So I know we've tried to do this bill years before. I want to thank all the advocates and everybody that reached out to us that told us how important this is to us, to Dino Varelli of Project Purple, who's a resident of one of the best towns in the state of Connecticut, Beacon Falls. Thank you for your advocacy, and thank you, everybody. Thank you, Madam Chair.
Thank you very much. It's a gift when we're able to provide some hope in terms of moving forward for folks. So seeing and hearing no other questions and comments, Madam Administrator, would you kindly call the roll?
Senator Anwar,
We did not hear you, Beverly. Madam Administrator.
Senator Anwar,
So Beverly, we still cannot hear you. Can you hear us?
yes, I can.
I can read your lips. You said you can hear us, but we can't hear you.
Can we have Peter do the votes? Can you text Peter to do the votes on me?
We'll be in recess for a second. So because of the sound system issue, because we cannot hear some of our people who are on the Zoom, and also we cannot take the roll call, and we want the public to be able to hear this clearly, we are going to be in recess. We are trying to get that fixed. So bear with us for a little bit.
Check, check, 1, 2. Mic check. Check, 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 1, 2. Check, check, 1, 2. Mic check, check, check.
For those of you who are online, I see Senator Gordon. Can you unmute and just say hello to us so that we can see if we can hear you here in the room?
This is McCory. Can you guys hear me?
Okay, hold on. Ladies and gentlemen, if I can just ask everyone, we're still in recess, but I'd just like for everyone in the room to be quiet for a moment. We're just testing to see if those of us. So Senator Gordon, can you say hello and see if we can hear you?
Hello, Madam Chair. Very nice to see you today.
Yay, wonderful. We all heard Senator Gordon, right? Okay, great. Thank you very much. So hang on, we may come back very shortly. Okay, we're back. Thank you everyone for your patience and thanks to our IT and sound team for helping us get back online. So we are back to taking a vote on item number 1, which is Senate Bill number 1191, an act establishing a pancreatic cancer screening and treatment referral program. This is a JF to the floor. We've already had our motions, we've had our discussion. And now, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCory, Senator Summers, Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Burgess Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné, Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Hockedal,
Senator Hockedal votes yes.
Cabris DeGraw,
Cabris DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow, Representative Martinez,
Representative Martinez votes yes.
Representative Parker, Representative Morin Bello,
Lauren Bello votes yes.
Representative Perrello, Representative Paletta, Senator Rahman,
Yes.
Representative Reddington Hughes, Representative Ryan,
Representative Ryan votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Zupkis,
Yes.
Representative Parker,
Senator Parker votes yes.
Representative Morrow, Senator Kushner, Representative Kennedy. Oh, yeah, sorry. Representative Gilchrist, Representative Elliott, Representative Dauphiné, Representative Burgess Givallo, Senator Summers, Senator McCory,
Corey's a yes. And I'm here.
Senator Marks. Thank you, Madam Chair.
Thank you, Madam Administrator. So those of you on Zoom, you're still fuzzy here in the room. We thank you for using your outside voices, and we still got the yes. Amazingly, the Zoom transcription can translate that fuzziness accurately as well. So the votes will be held open until 3 p.m. today. Moving on to item number 2, Senate Bill number 1192, an act concerning hospital financial assistance. This is a JFS to the floor. May I have a motion? Moved by Representative Kit, seconded by Senator Anwar. This is LCO number 4582. Thanks for the teamwork, Senator Anwar. This item is one that was a bill that was passed out of the House last year, the version that is almost the same version that's before us. We have S language, which essentially asks that not only the internet link, but also a phone number and electronic and an email address for the hospital financial assistance referral contact, that those are also sent to the Office of the Health Advocate. And just one other slight change in terms of changes to the financial assistance referral contract. That, in other words, those at OHA have the full and accurate information in order to be able to help folks who have come to receive assistance. This bill, it just as a reminder, it works with the Office of the Health Advocate, and in concert with the hospitals, the OHA will contract with a vendor to create an online assistance portal, which will provide access and information and try to streamline that process. I'd like to thank especially the folks from Health Equity Solutions who have really been the drivers of this conversation. We know that there are many other aspects of this bill, things that people would like to add. We would hope that this is a start to a conversation that we can continue to expand over time in an effort to assure that we are addressing a growing issue for so many people, which is the issue of medical debt. Also would like to thank the governor's office and some of the folks from OPM who helped get us to the compromise on this, and the governor's priority for helping to eliminate medical debt. So is there a discussion on the item? That we have to do a roll call. Seeing or hearing none? Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCory,
McCory's a yes.
Senator Summers, Representative Clara Desdichia,
Claire Desdichia votes yes.
Representative Burgess Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné, Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Jenga,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Huckadell,
Senator Hockenell votes yes.
Representative Cavers-DeGraw,
Cavers-DeGraw votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow, Representative Martinez,
Representative Martinez votes yes.
Representative Parker,
Rep. Parker votes yes.
Representative Moore Bello,
Representative Moore Bello votes yes.
Representative Perello, Representative Paletta, Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes, Representative Ryan,
Votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Zupkis, Senator Marks, Senator Summers, Representative Burgess Givallo, Representative Dauphiné, Representative Elliott, Representative Gilchrist, Senator Kushner, Representative Morrow, Representative Perello, Representative Paletta, Representative Reddington Hughes. Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 3, House Bill number 6835, an act adopting the Physician Assistant Licensure Compact. This is a JF to the floor. May I have a motion? Moved by Representative Claridis Detra and seconded by Senator Anwar. This committee has had a series of compacts here over the years, and I'm pleased to have this compact for the physician assistants before us today. This is a licensure compact with which will, as have the other compacts, help with workforce issues. This would authorize those PAs who are licensed in a participating state to practice across boundaries. And as you may recall, the compacts are agreements that are among all states, so it's not the kind of thing that we're doing a lot of amendments to. I know we have had some conversations in, for example, you might recall the nursing compact where we had a lot of agreements, but at this point, the PA compact language is similar to what we are seeing in other states. The compact itself will set eligibility criteria, disciplinary actions, allow an assessment to be provided, and in terms of amendments, would only allow for amendments if all of the participating states agree. Is there discussion on the item before us? Seeing and hearing no discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Yes.
Senator Marks, Senator McCory, Senator Summers, Representative Claridis Detra,
Claridis Detra votes yes.
Representative Burgess Givallo, Representative Biggins,
Biggins votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné, Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Jengo,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Hockenell,
Senator Hockenell votes yes.
Representative Cabras DeGraw,
First DeGraw votes yes.
Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow, Representative Martinez,
Representative Martinez votes yes.
Representative Parker, Representative Moore Bello, Representative Perello, Representative Paletta, Senator Rahman,
Senator Rahman, yes.
Representative Reddington Hughes, Representative Ryan,
Votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Zupkis. Thank you, Madam Chair.
Thank you, Madam Administrator. Another reminder, votes held open till 3. Moving on to item number 4, House Bill number 6838. This is an act concerning access to substance use disorder treatment facilities. This is a JFS to the floor, LCO 4556. May I have a motion?
So moved.
Moved by Senator Anwar, seconded by Representative Claritas Detra. I would like to start just by saying thank you to Representative Carney for being such an ongoing advocate for these issues. This bill before us today will allow a person to be committed to a DEMIS or private facility for emergency alcohol and drug abuse treatment if they've repeatedly overdosed or have been administered Narcan on multiple occasions. And in addition, the bill will prohibit a rehab facility that treats people with substance use disorders from requiring that a person be intoxicated or test positive for use of opioids for admission. Is there discussion on this item? Representative Claritas Detra, to be followed by Rep. D'Amico.
Thank you, Madam Chair. And as Madam Chair mentioned, Representative Carney, this is something that's been very important to him, and we've tried to move it forward. It seems like common sense that if you want to go to a rehab facility, that you shouldn't have to go down the street and shoot up or have a shot of something to get the help that you need. So hopefully we can move this bill forward and get the people of the state of Connecticut the help that they need. Thank you, Madam Chair.
Thank you very much. Representative D'Amico.
Thank you, Madam Chair. Just looking for an explanation. What does the substitute language do?
Thank you very much, Rep. D'Amico. The substitute language, I think is clarifying language based on conversations with the agencies. And again, it's LCO 4556. It adds language to make explicit that talks about repeated overdoses on drugs or being administered an opioid antagonist on multiple occasions. And it specifically adds that language in the first section of the bill. In addition, it adds language in subsection B related to physicians providing emergency medical services in connection with drug overdose. So it specifies that language.
Thank you.
Thank you, Representative. Is there further discussion or question? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCrory,
McCrory is a yes. Thank you.
Senator Summers, Representative Claritas Detra,
Claritas Detra votes yes.
Representative Berger-Givallo, Representative Biggins,
Biggins is a yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné, Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Huckadell,
Senator Huckadell votes yes.
Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow, Representative Martinez, Representative Martinez votes yes.
Representative Parker. Representative Maureen Bello. Representative Perello. Representative Paleto. Senator Rahman.
Senator Rahman votes yes.
Representative Reddington Hughes. Representative Ryan.
Representative Ryan votes yes.
Representative Steinberg.
Representative Steinberg votes yes.
Senator Slapp.
Senator Slapp votes yes.
Representative Zupkis. Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 5 on the agenda, bills to be considered for change of reference action. We have a proposed House Bill number 5194, an act prohibiting certain lending practices by healthcare providers. The proposed action is a change of reference to general law. And the second item, proposed House Bill number 5775, an act concerning the safety of home healthcare workers. This is a proposed action change of reference to planning and development. Is there a motion? Moved by Senator Anwar, seconded by Rep. Claritas Detria. And I'm looking at the good chair of planning and development and the other chair of planning and development. And I realize, I'm sorry we didn't talk to you. I'm airing the family business here. Is there discussion on the item, Senator Anwar?
Thank you so much, Madam Co-Chair. Madam Co-Chair, I first wanted to thank Representative Martinez and some of the colleagues who have actually proposed Senate Bill 5775. This is a continuation of the work that has happened on making sure that our home health workers are safe. And Representative Martinez, we had a conversation. The issue is that at times, home health workers have to park the car in different areas to take care of the patients across the municipalities. And in order to reduce the risk, if there was a way to allow them to park in some of the areas where close to the patient's home, and it could be a no parking area if there was a way, and this is because every municipality has a different rule, but the Planning and Development Committee has the authority to make it across the board for home health workers to have that ability to not have to walk a few blocks late at night when they're seeing their patients. I think that was the rationale. And we felt that this falls under, and we were informed that it's better to have it under Planning and Development Committee. So that's a rationale for this. And as I say this, I'm sort of advocating that would help our home health workers too. So I'm just going to stop here. Thank you, Madam.
Thank you, Senator. Senator Rahman.
Thank you, Madam Chair. Thank you, Mr. Chair, for explaining us, even though we didn't know, we was talking about why is the Planning and Development Committee should be the Public Health or Agent Committee. So I understand you explained everything. Thanks.
Thank you for your graciousness to our chairs here in the committee. We appreciate that. And we recognize, as in public health, everyone is juggling a lot of bills. So we know you'll see how this fits into the workflow over in planning and development. Also, general law for our general law friends. Is there further discussion on these items? And if not, we will have a voice vote. So those online, if you can unmute and prepare to vote. All those in favor, please signify by saying aye.
Aye.
Opposed? Thank you. With that, we will move on to item number 6. These are bills to be reserved for a subject matter public hearing. You might recall, and for those who are new here in the committee, subject matter public hearing means that we will hear the proposed bills as opposed to fully drafted legislative language. We have 2 before us, and we will actually take them one at a time. We have proposed Senate Bill number 568, an act establishing a task force to develop a statewide plan to reduce morbidity and mortality caused by.
Venous thromboembolism.
Thank you. We are a team. Is there a motion? Moved by Senator Amor and seconded by Rep. Cavros DeGraw, no, excuse me, by Claire DeStitria. They're both, yes. Thank you. And is there discussion on this item? Senator Gordon.
Yes, thank you, Madam Chair. And this is a good bill. I'm glad to be supporting it to see what we can do to move things forward, to better educate and to better raise awareness for blood clots, which venous thromboembolism is the fancy medical term for blood clots, especially blood clots that travel to the lung. This still is a medical issue that unfortunately kills a lot of people, including in Connecticut. So anything we can do to raise awareness and education, and anything we can do to decrease people dying of blood clots, all the better. So I enthusiastically support this bill. Thank you.
Thank you very much. Representative Mara.
Thank you so much, Madam Chair. I certainly appreciate the intent of this bill, and I am happy to listen to what's going to happen during the public hearing. I did spend a lot of time in this particular area as a pharmacist as well, and realize that much education is needed around this. I just question whether it is the state's job to do that and if it's actually the role of government. So that's one of the things that I'm going to be contemplating as we listen forward, but I will vote for it today. Thank you.
Thank you very much. Is there further discussion on the item? Again, to have a subject matter public hearing. Representative Kit.
While I agree with Rep. Mara's concerns about what the role of the state is, as someone who's had 3 different episodes of DVT and 1 PE, I am very much in support of hearing what this bill is going to contain and what we can do to help educate the public about this.
Thank you. Seeing and hearing no other conversation, we will have a voice vote. And those online, if you could unmute. All those in favor, please signify by saying aye.
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 Opposed? Wonderful. Thank you so much. All right, we'll move on to item 2. This is proposed House Bill number 6556, an act concerning the appointment of receivers and the exercise of eminent domain to ensure the continuity of healthcare services in hospitals facing financial distress. Is there a motion?
So moved.
Moved by Senator Amor. Is there a second?
Second by Senator Rahman.
Thank you, Senator Rahman. Representative Claire DeStitria.
Madam Chair, I'd like to do a roll call vote on this.
Thank you, Representative. Discussion on the item. Representative Zupkis.
Thank you, Madam Chair. Madam Chair, so I am part of Waterbury and I completely understand everything that is going on with the hospitals. However, this bill has to do with eminent domain, correct?
Indeed, it is even in the title.
Thank you, Madam Chair. I will be a no strictly because of that. Thank you.
Thank you, Representative Zupkis. Having chaired planning and development for 4 years, I'm extremely aware of some of the sensitivity around the issue. Given the seriousness of what has occurred, as you know well, Representative, we felt that it prudent to be able to hear this and hear from the folks, many of our colleagues, both sides of the aisle in both chambers who are concerned, and thus the holding a subject matter public hearing as opposed to fully drafting the language. Thank you. I believe Representative Kennedy.
Thank you, Madam Chair. Madam Chair, agree with you for the most part. I do want to have a public hearing on this to hear what the public has to do, to see what our colleagues want to, but I do have concerns with the exercise of the eminent domain, but I want to have the opportunity to hear from everyone. So I will be a yes today and then see what our language going forward is. So thank you, Madam Chair.
Thank you. I do think the public hearing will be a great opportunity to explore all avenues. We know that Massachusetts, our neighboring state, did pass some of that eminent domain language in part or because of the terrible situation that they also faced in their state. So we will have a robust discussion at the public hearing if we decide to vote yes today. So Senator Gordon, excuse me, I'm sorry. Senator Gordon, please hold on 1 second. We're going to go to Senator Amor and then Senator Gordon.
And a brief comment, if in the public hearing, people don't like the eminent domain, we can send it to planning and development, Madam.
We are not hearing any eminent domain this year.
Oh, that's so great. Senator Gordon.
Thank you, Madam Chair. I do understand the need for part of this legislation with regards to receiverships. I have Rockville General Hospital in my district in Vernon, and I'm well aware not only the mess that Prospect created, but also the gigantic mess that Stewart Health created up in Massachusetts, which is going to cost the taxpayers up there well over $700 million to deal with. But I do share serious concerns about eminent domain in general. I don't like eminent domain, especially given the Supreme Court ruling some years ago that affected New London. So I do want to hear more about this, but I do very much advocate for not having an eminent domain provision, but still keeping a receivership that goes through a proper process. Thank you.
Thank you, Senator Gordon. Representative Clara DeStitria.
Thank you, Madam Chair. To reiterate what everybody else said, I think we need to get this eminent domain piece out of this bill. I will vote today to hear this bill, but I think it's pretty important for most of us and the general public to make sure that this piece does come out of the bill. Thank you, Madam Chair.
Thank you. I guess in public health, our ED conversation is more, we'll let planning and development have the other ED, but no, we are voting today to agree to hear this proposed bill concept in its entirety. And of course, we'll then have to go forward as a committee to decide together whether and how we would go forward. So with that, seeing and hearing no other questions or comments, Madam Administrator, would you kindly call the roll?
Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy Vehy.
McCarthy Vehy votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory.
Senator McCrory is a yes.
Senator Summers. Representative Clara DeStitria.
Claire DeStitria votes no.
Representative Berger Givallo. Representative Biggins.
Biggins votes yes.
Representative Carpino.
Representative Carpino votes yes.
Representative Dauphiné. Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jengo.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes yes.
Senator Hockedal.
Senator Hockedal votes yes.
Representative Cabras-Degra.
Cabras-Degra votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner. Representative Morrow.
Mara votes no.
Representative Martinez.
Representative Martinez votes yes.
Representative Parker. Representative Morin Bello. Representative Perello. Representative Paletta. Senator Rahman.
Senator Rahman votes yes.
Representative Reddington Hughes. Representative Ryan.
Representative Ryan votes yes.
Representative Steinberg. Senator Slapp.
Senator Slapp votes yes.
Representative Zopkis. Representative Steinberg. Representative Reddington Hughes. Representative Paletto. Representative Perello. Representative Morin Bello. Representative Parker. Senator Kushner. Representative Elliott. Representative Dauphiné. Representative Berger Givallo. Senator Summers, Senator Marks. Thank you, Madam Chair.
Thank you so much, Madam Administrator, especially with all of the technical issues today. The next item is simply an announcement of the time and date of our next meetings. We have a committee meeting scheduled for Friday, February 14th at 1:30, and then another committee meeting for Wednesday, the 19th at 11:30. Again, votes will be held open until 3 p.m. And we thank you all for being here with us today and for your patience. Have a great Monday.
Hi there, can you hear me? Hi, I can't hear you. Can you hear me?
Can you hear me?
I can hear you now, yes.
I can hear you. Okay, good. I can hear you. All right. So we
Good.
had a vote on, let me see what I have you here. Have you for that one?
Yeah, I did a
Mhm.
voice vote on concepts to be raised.
Mhm.
And then for bills to be considered for JF action, I believe I voted on 1 and 2.
Okay, I have you for item 1 and item 2 of the JF.
Yes,
I am missing you for item number 3, which is HB 6835, an act adopting the physician assistant licensure compact. How would you like to vote?
I'd like to vote yes.
Okay. The next vote, HB 5838, an act concerning access to substance use disorder treatment facilities. How would you like to vote?
Yes.
Okay. And then we had a vote on, let me get an agenda in front of me.
Yeah. Bills to be considered for change of reference action.
I believe we had a voice vote on both of those. Let me
Okay.
just make sure.
Yeah.
5194 and 5775. Yep, those are two voice.
Yes. Okay, I'm a yes for both of those.
And then proposed bill to be reserved for subject matter public hearing. The first bill, I believe, was a voice vote, 5665 SB 568. Let me make sure. Yes, it was a voice vote. And then for proposed HB number 6556, an act concerning the appointments of receivers in the exercise of eminent domain to ensure the continuity of healthcare services in hospitals facing financial distress. We had a roll call vote on that, so.
Okay, so I
How'd
am
you
a
like-
yes, I am a yes for both of those as well.
Okay, and then let me make sure you're all set.
Okay,
Okay, you're all set. They're all
okay,
good.
appreciate that. Thanks so much.
Have a good one.
Thank you, you too.
Hello, can you guys hear me?
Peter, how are you?
Hi, Senator Marks. I'm good. How are you?
Good.
Good. Okay. So for the concepts to be raised, all of those except items number 15 was a voice vote. And then next on our agenda, so bills to be considered for JF action, they were all roll call votes. So let me get the tallies real quick. So the first item was SB number 1191, an act establishing a pancreatic cancer screening and treatment referral program. How do you like to vote?
Senator Marks votes yes.
Okay. The second item is SB 1192, an act concerning hospital financial assistance. How do you like to vote?
Senator Marks votes yes.
The next item is HB 6835, an act adopting the physician assistant licensure compact. How do you like to vote?
Yes.
The next item is HB 6838, an act concerning access to substance use disorder treatment facilities. How do you like to vote?
Yes.
Thank you. And then our next section of the agenda was bills to be considered for change of reference action. Those were all voice votes. And then our next section, proposed bill to be reserved for subject matter public hearing. Item number 1, proposed SB number 568. That was a voice vote. And proposed HB number 6556 was a roll call. How do you like to vote? So I'll read the entire bill. HB 6556, an act concerning the appointment of receivers and the exercise of eminent domain to ensure the continuity of healthcare services in hospitals facing financial distress. How do you like to vote?
Can I ask what the vote tally is so far?
Currently,
I'd like
we have 3 no's.
Senator Marks votes yes.
Okay. And then that was it. So you're all good.
I appreciate you.
Yeah, you too. Have a good one. And then Representative Paletta.
Yes, thank you so much.
Okay. Now, let me.
I thought I saw you walking up the stairs and I went down to public health and yeah.
I saw you walking up the stairs. I was about to say, oh, I think I need your vote. Exactly.
No
Okay.
problem.
So for the first part of our agenda, so concepts to be raised, all of those were a voice vote except item number 15. Mhm.
Yes.
Okay. And then next, for bills to be considered for JF action, all of those were roll call votes. So let me start the tally. Let me get the tally.
Sure.
Mhm. So number 1 on our agenda. Oh, I'm taking the vote. So yeah, let me do it real quick. Yeah. So number 1 was SB 1192, an act. Oh wait, no, sorry. It was SB 1191, an act establishing a pancreatic cancer screening and treatment referral program. How do you like to vote?
Yes.
Item number 2 was SB 1192, an act concerning hospital financial assistance. How do you like to vote?
Yes.
The next item was HB 6835, an act adopting the physician assistant licensure compact. How do you like to vote?
Yes.
And then, let me see, sorry. The next, where is this? Sorry. Next was HB 6838, an act concerning access to substance use disorder treatment facilities. How do you like to vote?
Yes.
Yeah. Our next part of the agenda was bills to be considered for change of reference action. Those were all voice votes.
Okay, that's a yes as
And
well.
then next on our agenda was proposed bills to be reserved for subject matter public hearing. Item number 1, SB number 568 was a voice vote. And then item number 2, HB number 6556 was a roll call.
So I'll do yes on the first one, no on the second.
Or no on the second? Okay. All right. Thank you. Then you're all set.
Thank you for your time. Bye-bye.
You too. Have a good one. Mhm. So the bill is HB 6838, not concerning access to substance use disorder treatment facilities. How do you like to vote? Very good. Okay. Hi, good afternoon. Sorry. I was just making sure everything's ready. Can you hear me all right?
I can. How are
Okay, that's
you?
good. I'm good. How are you?
Good. Trying to get
That's good.
my committee straight here all over in front of me.
I understand you.
So it sounds like you guys had a voice vote for 1 through 18?
Yes, except number 15 was not included in that.
Oh, okay. And was there no's on that?
We didn't take action on that.
Oh, okay. Okay, let me just, all right.
And then for JF actions, we had all roll call, so I'm ready when you are.
Okay.
Okay. Item number 1, SB number 1191, an act establishing a pancreatic cancer screening and treatment referral program. How'd you like to vote?
Yes.
Okay. Item number 2, SB 1192, an act concerning hospital financial assistance. How'd you like to vote?
Were those all yes too, Christian?
Say that again?
Were those all yes?
Yeah, I have
Yes.
all yeses. So.
Yes.
And then item number 3, HB 6838. Oh, sorry. It'd be HB 6835, an act adopting the physician assistant licensure compact. How'd you like to vote?
Yes.
And then the last item is item number 4, HB number 6838, an act concerning access to substance use disorder treatment facilities. How'd you like to vote?
Yes.
Okay. And then the next section of our agenda was bills to be considered for change of reference action. For those 2 items, we both did voice votes for those.
Okay.
And then for the next part of our agenda, proposed bills to be reserved for subject matter public hearing. Item number 1, SB number 568 was a voice vote. And then item number 2, HB number 6556 was a roll call.
Yeah, and I'll be a no on 6556.
Okay. And then you're all set.
Thank you
Those
so
are all the
much.
weapons.
Have a great day.
Yeah, you too. Have a good one. Oh, you're muted.
Hi.
Hi. Let me just get all my documents. All right. So for our first part of our agenda, concepts to be raised, we had a voice vote on items 1 through 14 and 16 through 18. Items number 15, we didn't take action on.
What is number 15?
An act concerning various recommendations of the Connecticut Hospital Association.
Okay, I'll vote yes.
Our next part of the agenda, bills to be considered for JF action. We had roll calls on all those, so I'll start the tally. So our first item was SB 1191, an act establishing a pancreatic cancer screening and treatment referral program. How would you like to vote?
Yes.
Our second item was SB 1192, an act concerning hospital financial assistance. How'd you like to vote?
Yes.
Our third item was HB number 6835, an act adopting the physician assistant licensure compact. How would you like to vote?
Yes.
And our final item for that section was HB 6838, an act concerning access to substance use disorder treatment facilities. How do you like to vote?
Yes.
Okay. Our next part of the agenda was bills to be considered for change of reference action. Both items in there, HB number 5194 and HB number 5775, those were voice votes.
Okay.
And then our final part of the agenda, proposed bill to be reserved for subject matter public hearing. SB, or item number 1, SB number 568, that was a voice vote. And item number 2, HB number 6556, an act concerning the appointment of receivers and the exercise of eminent domain to ensure the continuity of healthcare services in hospitals facing financial distress. That was a roll call.
Yes.
Yes, okay. All right, you're all set.
All right, thank you.
Yeah, have a good one.
Sure, you too. Bye.
Bye.
Thank you.
Hello? Hello?
Hi.
Hi, okay. Yeah.
I don't know what they voted on.
I'll let you know. I'll go through the agenda, don't worry.
Oh, okay,
That's okay.
thanks.
Yeah. So the first part of our agenda, concepts to be raised, we had a voice vote on items 1 through 14 and items 16 through 18. Items number 15 for concepts to be raised, we did not have action.
Okay, so we just did it as one big,
Voice vote, yeah.
were they one by one or they were just one big?
It was one big. It was one big voice vote on items 1 through 14 and 16 through 18, yeah.
Okay, 1 through 14. Because I mean, I would be no on some of them, so I guess I would vote no.
Okay. All right.
I mean, I'm just trying to, because it would be the proposed bills 1 through 14.
Yes, I believe so, yes. For concepts to be raised.
Yeah.
For which items would you like to indicate a no?
A no would be number 1, number 2,
Okay.
number 5,
Okay.
number 6,
Okay.
number 9,
Okay.
number 10,
Okay.
number 12,
Okay.
and number 14.
Okay. And that's all for that section?
Yeah, yes.
Okay.
So
And
let
then-
me just, I'm gonna go over them again. So
Yeah,
no
okay.
would be number 1, number 2.
Mhm.
Number 5, number 6,
Okay.
number 9, number 10,
Okay.
number 11,
Oh, okay.
number 12,
Mhm.
and number 14.
Okay. Okay. And for our next part of bills to be considered for JF action, we had a roll call on all of them, so when you're
Okay.
ready. Mhm.
All right, so they start at number 15, right?
No, it'd be item number 1 for bills to be considered for JF
Oh,
action.
okay, I'm sorry. I'm on the wrong page here.
Yeah, it's okay.
All right, so these others,
Okay. And I'll start when you're ready.
okay, 1 second. The maybe. I'm just, so proposed, okay, so I have proposed bills to be drafted. And then that goes up to,
We don't have any proposed bills to be drafted on our agenda.
oh gosh, I have the wrong committee.
Oh, okay.
All right, what committee are you?
Public health?
Oh, public health. Oh God, I'm sorry. Okay, could you please like get rid of all that I told you?
Okay, everything is out
Yeah,
of my mind.
just
It's out of there.
bring it,
All right.
bring it back. And let's see, this is probably,
I can wait for you to get ready if you'd like to.
okay, no, I have everything here now at this point. I'm looking at, so you said this makes a lot more sense because I'm like, why did you
Yeah.
exclude these other things?
Okay, exactly.
Okay, so it's 1 through 13 to be on consent, right?
1 through 14.
Oh,
It's everything
14?
except 15. It's everything except 15 for the first section.
Oh, okay. Let's see, everything,
So the only one getting excluded is an act concerning various recommendations of the Connecticut Hospital Association.
oh, okay. All right. Yes, it will be a yes.
Okay.
Makes that one easy.
Yeah.
And then let's see what we have. Bills to be considered for JF.
Exactly, yes. And I can read through the items just to make sure.
Okay.
Okay.
I'll say, Oh, yes. What, the first one?
SB number 1191, an act establishing a pancreatic cancer screening and treatment referral program. How'd you like to vote?
Yes.
Okay. Item number 2, SB 1192, an act concerning hospital financial assistance. How'd you like to vote?
Yes.
Item number 3, HB 6835, an act adopting the physician assistant licensure compact. How'd you like to vote?
6, 8, huh. 6835. I'm just looking for that. Yes.
Okay. And then item number 4, HB 6838, an act concerning access to substance use disorder treatment facilities. How'd you like to vote?
Statewide planners. I'm looking for that one, huh? And hospital financial assistance. Public hearing. I'm sorry, I'm just not finding that.
HB 6838, an act concerning access to substance use disorder treatment facilities.
Is that the I'm just trying to get familiar. Is that the one that would require someone to have it's like a where they would have a facility to use?
I believe so. Let me just double check
Okay.
just to make sure. To allow persons with a substance use disorder access to treatment and rehabilitation facilities when they are not intoxicated. That's what I have for the for that. Let me get the summary.
when they
Statement of purpose. Yeah.
Yes.
Okay. So you would like to vote yes on this item? Just to make it clear.
Sure.
Okay. So our next part of our agenda, bills to be considered for change of reference action. Items number 1, HB number 5194, and item number 2, HB number 5775. Those were voice votes.
Okay, 5194, yes. Prohibiting certain lending practices.
Yeah.
Okay, and 5775, is that the other
Yeah.
one?
Yeah.
And that's a yes on that one as well.
Okay. And then for our final part, so proposed bills to be reserved for subject matter public hearing. Item number 1, SB number 568, that was a voice vote. Item number 2, proposed HB number 6556, an act concerning the appointment of receivers and the exercise of eminent domain to ensure the continuity of healthcare services in hospitals facing financial distress. We had a roll call on that.
Okay, so number 1 is a yes. And number 2 is a no.
Okay. Okay. You're all set now. I got you.
I'm sorry for the confusion.
It's okay.
Well, thanks. I'm glad that I didn't cast those other votes. Have a great rest of your day.
You too. Have a good one.
All right. Take care.
You too. Bye. Say that again.
1191 is yes.
Okay, I have you for that.
1192, yes.
Have you for that.
6835, yes.
Okay, I have you for that.
6838, yes.
Okay. For those, we had voice votes.
Okay, terrific.
For that, we had a voice vote, and that was a roll call.
Oh, yeah, 6556, yes.
Okay. Yeah, we had.
Wonderful. Anything else?
No, you're good.
All right, thanks.
Yeah, no problem. Have a good one. Hello.
Hey there.
So I'm only missing you for one vote. So, for our last section of the agenda, bills to be reserved for subject matter public hearing. We had a voice vote for item number 1, SB number 568, but we had a roll call in HB number 6556, an act concerning the appointment of receivers and the exercise of eminent domain to ensure the continuity of healthcare services in hospitals facing financial distress.
I vote yay.
Okay, and you're all set.
Thank you for all your help. Have a good
Yeah.
one.
Have a good one. Yeah, sure, man. So I have you for the first voice, for the first roll call, which is SB 1191. Oh, SB, let me get a pen, sorry. Mhm. All right, I have you for that one. Okay. First one I'm missing you on is item number 3.
Yep. Yes.
Okay, for that, yes. For this
Or
one,
yes.
yeah. Okay.
You was voting on that?
No,
I
no.
wasn't on it.
Yeah. So voice votes for these,
Perfect.
voice vote for that one, and then this one is a roll call.
I guess I'll be a yes.
Okay. Eminent domain.
Hmm.
Hello, good afternoon.
How are you?
I'm good, I'm good. Okay. I'm ready to start when you are.
Okay, run through.
Okay. So for concepts to be raised, items 1 through 14 and items 16 through 18, that was on a voice vote. We had no action on item number 15.
Oh, okay.
Okay. So, and then the next part of our agenda was bills to be considered for JF action. We had a roll call for all of those, so I'll start when you are, when you're ready.
Okay.
Okay. So the first item was SB 1191, an act establishing a pancreatic cancer screening and treatment referral program. How'd you like to vote?
Yes.
Okay.
I'll save you the time. I'm yes on everything. I don't typically object to holding public hearings,
Okay. And
even if I don't like the bill.
okay, so I'll just do the last one then. Or the one I'm unsure about. So we had a roll call on for the last section, proposed bill to be reserved for subject matter public hearing. For item number 2 in that section, proposed HB number 6556, an act concerning the appointment of receivers in the exercise of eminent domain to ensure the continuity of healthcare services in hospitals facing financial distress. That was a roll call. Is that, how'd you like to vote?
I'm a yes.
Okay, all right.
Like I said, nothing so dangerous we can't talk about it.
Okay, all right, then I got you. You're all good.
Thanks.
You're all set. Have a good one.